Well, good morning, everybody. Again, I'm Mayor Rob Green, and I'll be facilitating and moderating this discussion now, which is the breakout session for healthcare disparities in COVID-19 and the impacts on your organization. So, our panelist, our special guest star for this will be Dr. Nafisa Ebone, and she is the Public Health Director for Black Hawk County Health Department. I've had the great privilege and joy of working with her through this COVID crisis pandemic and have the utmost respect for her knowledge, her passion, and her general awesomeness. So she has earned a doctorate degree in public health education from Texas A&M, where she's been working in education and research. She also holds a master's degree in public health promotion and an undergraduate degree in public administration, both from San Diego State University. She was born in the West African nation of Niger, but was raised in Illinois and later College Station, where her parents worked as college professors. She worked with those afflicted with HIV and refugee communities in San Diego. She has a strong multicultural background, which includes fluency in 4 languages. I barely have one down, which has helped her relate to the immigrant population and help with their health needs. So, uh, our purpose today is going to be to coach Cedar Valley organizations in evaluating and being proactive on how to address issues of diversity and inclusion and equity and related issues in light of COVID-19. So without further ado, Dr. Nafisa Ebune, go ahead.
Thank you, Mayor Green. Thank you very much. And I'm going to make this a bit more conversational. I think that most viewers, with the COVID pandemic, the health department has been highlighted quite some time, but I've been really enjoying the conversations that we've been having about equity and diversity and inclusion. And so I'm going to include bits and pieces of that in my presentation. So I'm going to share my screen and I might, unshare for some time and share again, but bear with me so that I can just give an overview of the health department's journey. So I need to have access to screen sharing. Okay, thank you. Okay. All right. So the health department, our journey, really this new role that we're calling ourselves is the health equity strategist role, and it's a very important. Health equity is a very important concept right now in public health. But just a brief overview, as you all are aware, the demographic changes are occurring everywhere in the U.S., but also in Iowa and in Black Hawk County. So when you look at Black Hawk County, we are predominantly a Caucasian community of about 80%. But we have an African American community that makes up 9.7% of our population. We have Hispanic, Asian, 2 or more races, American Indians, and Native Hawaiian, other Pacific Islanders. In addition to that, of our population, about 5% of the population are foreign born and originating from Europe, Asia, Africa, and the Americas. And what to me is so exciting to share is that over 40 different languages are spoken in Black Hawk County. That's a lot. That's a lot. It really highlights that diversity, not only in terms of like larger groups, but also within those groups. For example, I've learned over these past few years that the people of Burma, there's only a small group of Burmese, but we have Karenni, Chin, Karen, So there's very diverse ethnic groups among those groups. We have the Liberian community, and even within that, there's also different ethnic tribal groups. Congolese, we have different ethnic groups as well. So it's very important to keep in mind that as we develop programs for diversity, inclusion, or equity, that we recognize that even among those populations, that there's also diversity. So this is some data that I share around why the health department has taken on this role. One of the things that public health has been intentional about is understanding the determinants of health and also the inequities within those determinants of health. The determinants of health are really the condition in which people live, learn, and play. It's normally called the social determinants of health, but the more we do equity work, we realize that social that term tends to drive certain groups away. So that the department, we like to call it the determinants of health. So when you look at Black Hawk County in comparison to 99 counties here in Iowa, 99 being the worst, when you assess, so we rank 86 out of 99 counties for social and economic factors. And so that's a very important thing to understand, because that's what we're talking about today.
And Dr. Bonnier, just to
Yes.
interject real quick, what we're seeing right now is still your slide that says health equity strategist. Did you mean for us to
Oh,
be seeing forward on those?
yes. Do you
Okay.
see, what do you see now?
Yeah, we see determinants of health now. So are you showing on two screens?
Yes.
So it's only showing right now your manager screen.
Okay, I don't know why it's doing that. How about now?
We see a beautiful scenery of snow.
Okay. I don't know
Okay.
why it's doing that. So I will just, as long as you can see.
Yeah, we could see that fine. So if you want to just continue using that.
Okay, 1 second. All right. So then here you have where the news article that mentioned Waterloo and Cedar Falls cities, Iowa, ranked as the #1 worst city for Black Americans in 2018. And I know as a public health director, there's been different sentiments. You know, when it first came out, people were asking questions about, is this data real? You know, this data is also, you know, old. People have stated it's about time. This is not something new. But for me as a newcomer in this community, I can truly say that it didn't need to take for data to be able to know that there is some truth to this, because you do feel as a newcomer how segregated our community is, and you know, at times I've been told, you know, where it's best to purchase a home, or what areas, you know, to not navigate at night or so. And I chuckled because, you know, I moved here from Houston, and Harris County is always on First 48 show. So I was really intrigued by some of the statements that I heard very early on when I arrived here. So I think there's really some profound truth in this article, regardless of how the data originated. As you see with the county health rankings, we are ranked 86 out of 99 counties. So there is some validity in that. So the health department, we took on this new role, and it was very important for us to do that, because traditionally the health department was known as providing school nursing services, and really public health has shifted from that. We here at the health department, we wanted to take on a role that would address the inequities in the conditions in which people live. So this role was to create a community that is resourceful and resilient to transformation and believes in the empowerment and solidarity of its residents to achieve optimal health. The health department functions to serve as a resource to partners who are advocating for equity, where we play, work, learn, and worship, advancing unique and culturally sensitive strategies that promote human development and optimal health, and promoting a system of shared community assets to guide the work of local partners to reduce health disparities. I think that our system is intentional in also not only segregating communities, but also segregating sectors. And so it's very segregated concept, even with organizations, doesn't allow us to be in sync with each other. Meanwhile, it's the same population we're serving. And so for a health department, it's very intentional that we're seen as a partner, as a convener. And one of the things that at the health department we continue to ask ourselves is, are we best to serve, are we best to have this program? If there's an entity that can do this better, that can serve the population better, even if funding comes to the health department, I think that it is our obligation to be able to have the funding pass through to organizations that are the key to serving or to doing the program in a more efficient manner. And so for us, again, it's really important with this equity work that we're seen as a partner. We are a partner, and we do believe in promoting a system of shared community assets. So we took on a systems approach to understanding health equities. Oftentimes you hear when you talk about equity or diversity, people tend to take it from an individual approach, like, oh, I'm not racist. I treat everybody fairly, but it's really beyond that. It's recognizing that our system has not served us well. It's recognizing there are policies that have fostered inequities and have contributed to the inequities in the conditions where how we live. And so it's really important to understand systemic racism and how that has contributed to the inequities that we see today. So we invited a group of community stakeholders, and we asked them what accounts for the level of equity experienced by our community. We wanted to know what's working and what's not working. And so the stakeholders identified some of our inhibitors like racism, policy and politics that maintain inequity, entrenched mindsets and resistance to change, financial exclusion and poverty, rejection of the other, history, legacy of exclusion, access to mental health, physical health services. They felt that there was fear. There was fear in our community and lack of support to families and communities. But the good things that stakeholders have identified within our community is that we do believe we have quality of education. We do believe that the diversity of our community is a good thing. We do believe that we have a presence of coalition and a willingness to work together and a strong economy. So with that, and here I'm just going to share just pictures. We created some loops. We created about 50 different loops that was put together to create what we call an equity map, which I'll show later, but I wanted to just show the level of engagement that occurred during the past few months before COVID. And the health department team, what we then did was to synthesize the data. So I'm gonna try something Mayor Green here, and hopefully it will show. One second. I'm going to stop screen sharing for just a second. Okay. Are you able to see this map?
Just a moment. Yes, we can see a mind map there.
Yes. Okay. So this is our equity map. And basically, we put these loops in what you call Kumu. It was our way to gather data because we wanted to demonstrate to people how systemic this is, that this is not just about saying, I'm not a racist or I'm anti-racist, but there are systems at play here that promotes the inequities within our system. But one of the things we asked the community members was, where does our story begin? And this is called the deep structure. So when you click here, you see the deep structure, and I can share this. Everybody can play around with this. You will not damage our map. It is for you all. It is for the community, but it's really it's where the stakeholders have identified that this is the beginning of Black Hawk County. Basically, we all recognize that we are a segregated community, and so it starts with this loop, and that this segregation promotes an us versus them mentality, which then increases the inequality of opportunities and of resources and access. And so when that increases the inequalities, there's fear. So and this fear really it's because when some groups some members of a population are doing well while others struggle, it creates a fear which drives people to either hold on to what they have and maintain the status quo, or mistrust the system, which has only caused them harm. So this fear then serves to further accentuate the divide between groups of people, and assuring that we never have the opportunity to build awareness of inherent human connection. And so this is something that I would like for those that are watching to eventually take some time to play with it. As you can see, the report is here. If you click on the report, it gives you the description of this particular loop. When we talk about economic inclusion, you see there's a loop here that talks about business connections and what happens when we lack diversity within our organizations. But we created, again, this so that people have see that it's really a systems issue, and we are still building data around it. And so in the different loops, you will see that there's data. If you hear resistance to change, there'll be information on that, and more is to come around this systems approach. But in the meantime, do play around with, we have articles such as Race in the Heartland, Segregation by Design, America's Poor Kids Child Poverty Documentary. These are videos that people can watch. Okay, I'm going to stop screen sharing.
It's a fantastic resource. And will you be sharing that link maybe in the chat?
Yes, I can do that as well. I can do that. Okay. Okay, and so again, these were just the loops like deep structure, the divided we fall. again, unequal treatment, and I've highlighted, that's loop 18. But unequal treatment basically talks about also when job applicants, with Black sounding names, not getting an interview despite being qualified, or foreign names, not getting an interview besides getting qualified. In yesterday's session, Kyle Rowe talked about that, where someone was just uncomfortable mispronouncing someone's name, and you could see they weren't as interested in even interviewing the person. And so those are all things that we have to take into consideration as we move to address equity. Um, Business connections, we talked about that. When there's this inequality of opportunity and access, what it does, it drives the gaps in the workforce, and then that in return, it drives businesses to build and attract talent. So businesses start to say, okay, what more can we do? And so you see then there's a willingness to include diverse population and perspective, which in return, so this negative sign is what happens when there's that willingness. It decreases in us versus them mentality, and increases. It basically decreases in us versus them mentality. So this is where it stops.
Okay, and then Dr. Bonnier, I think we have the same issue with the screen where it's showing.
Oh, is it again?
Yeah, it's sitting on determinants of health.
Oh, I'm so sorry. Technology is testing me today. How about now?
There we are.
Okay, good.
Business connection.
So again, it's the, when you look at the loop, the positives and negatives give you a sense of the direction in which the loops, the things that can shape the loops. And so I won't repeat this, but again, I will share the link which you will have to navigate the map. So in the United States, increasing wealth is associated with better health. COVID-19 has highlighted the disparities in not only just COVID, but also underlining chronic health conditions among people of color. Those underlining conditions. For me as a health director, the moment I saw it, I said, well, this is definitely going to impact people of color, because we already know that there's disparities within the chronic diseases that really are at risk for COVID-19. And so it lets us know that we have a lot of work to do, and this work will require all of us to be part of the solution. As we started addressing the COVID in the community, one of the things that was very important with the outbreak that we faced with the meatpacking plant was also, we noticed that once the closure occurred, there was almost like a sense of fear from business communities. And it was important that the message that the health department conveyed to businesses is really that we are a partner with businesses. We are, to be pro-business really means that you are the the safety and wellness of your employees, and therefore you are pro-health, you are pro-public health. And so that message was very important, so that businesses understand that our partnership is not to it's not to penalize businesses. We public health values businesses because we do believe that it's important to have communities that thrive economically. But it is important that we also recognize that in order for communities to thrive economically, people also have to be healthy, because people are the ones that drive the businesses. And so again, pro-health is also pro-business. So just to briefly touch, and then I'll So for questions the U.S. business community has its largest economic state ever in promoting and maintaining workforce health. And so public health, Blackhawk County Public Health can really partner with businesses to help worksite health promotion programs targeted to both individual workers and the physical and social environments at work. You know, one of the things when addressing with COVID is that we absolutely love when businesses reach out to us and ask them to review their plans, have questions for us, and we're able to do this in partnership. We love that because that just shows the unification, that shows that we have the same, our value is the community. And so I encourage business owners who are listening today to know that we are educators first before enforcement. We are educators first, and we value that partnership. Again, employers can change the work environment by offering healthier foods. We used to do a lot of potlucks at the health department, and we love our potlucks. But one of the things we've been intentional about is really our wellness committee has done a phenomenal job in providing healthier foods and recipes. And employers can partner with local governments to help communities better support physical activity, lifestyle, and advocating for things like nutritional education, mandatory physical education in all grades for children. And so those are some of the key things that are very important, and I encourage employers to really to be a partner with us in really advocating also for physical activity and the improvement of nutrition with our school-age children and also our overall community. Lastly, I want to touch base on this concept. Our keynote speaker talked a lot about the heart, caring for people and valuing people. I think that for our organizations to transform and to do right by our community, it is fundamental that our heart and mind connect. Like, we can no longer separate the two. You know, it's really important that as leaders within organizations, human services, and even private businesses, we shift from this old style of management, of very directive, but really placing values in our employees, understanding them, understanding their history, their communities, and being able to connect the heart and mind is going to be very key when we in order to address the inequities within our community. Equity is a value-based thing. It's a value, it's an emotional thing, and it's okay because that's important. Human beings are not made to be like a rock where we don't have emotions. So it's really something that culturally we need to also change in recognizing that emotions are okay and they're present with us at all times. So that is my message to you all. Let's continue to do this together and in partnership with not only organizations, but with community members as well. Thank you.
Well, thank you, Dr. Abonye. And we do have about 20 or so minutes for questions. So now we'll go into the conversation part of this session. I saw a question from Lisa Munoz. She asked, do you have any data on mental health inequities in Blackhawk County?
So that's one of the things that we're working on. We do mental health as a priority in our health improvement plan. We don't necessarily have, I think, some of the key data that we're seeking for mental health. When we did our community health needs assessment, one of the things that we've found out was access to mental health. People found it to be a barrier, and we have that on our website at Black Hawk County Health Department. Please do look at our community health needs assessment. It's pretty robust. But when we look at also, there's an issue of access, but also there's an issue of, culturally appropriate therapy. So different groups have a different perspective of what the therapy means to them, and so that's something that we're going to dig in deeper as we finalize our health improvement plan. Mm-hmm.
Okay. And Drew Conrad asks, what are a couple or a few health inequities in Blackhawk County that the community could address fairly quickly that would have an impact?
Oh, well, healthy behaviors. And as you see, we have one of the things are obesity rates. We can definitely, do some interventions in regards to that. So I do think one of the things on our health improvement plan is the nutrition education. So that's going to be something that we're going to look into tackling. I think also one of the things that will be very important is that we have a robust healthcare system here. But people talk very frequently about barriers to health services. And so I think that we need to start looking at what are the issues of barrier. I think that's something we can really resolve with our healthcare systems and partner with them. I know that, for example, about a year ago, I went and did and talked to Tyson because there was employees that just didn't understand their health insurance. And so, and that's something that's even common to the average American, right? And so I think that's one of the things that it's important is that how can we simplify even this approach for all of us? Like what are some of the tools that we need? So those are some of the things I do think are small wins that we can do rapidly.
Okay. And another one we had was, uh, what does how we've responded to COVID-19 tell us about our organizations?
So I think from my end, I want to just applaud everybody in terms of our response for COVID-19. We and you see that where with our stakeholders, they talked about the strong coalition. When we had the EOC and the amount of members and organizations that were present was remarkable. But not only that, I think it wasn't about presence, it was also engagement. They were thoroughly engaged, and I think that made a huge difference in our response, being able to be in sync with each other with rapidly changing information. I think that everybody was very intentional about what needed to be done so that we can mitigate the spread of COVID-19. So I think that the strong coalitions that we have is very real. It's people want to be engaged and do the right thing. What I think what's important for us to understand with the response to COVID, um, for me, when it's not every formula that will applies to all 99 counties. It's important at the local level to be able to say, what do we need for Black Hawk County? Because what Black Hawk County might need might be very different from Lynn County and Johnson County. So the health department always takes this approach of what is it that we need for Black Hawk County, and who do we need to partner with us so that we can achieve our goal. And I do want to say that every sector that we have sought a partnership has been very present and engaged.
Okay, thank you. And Danita Gadsden asks, are free health clinics used in the community, and what are the demographics? Can you talk a little bit about the People's Clinic and other clinics?
Yes, yes. So I do know that People's Clinic is frequently used. One of the requests that we're going to be asking for the healthcare systems is also we need to start sharing data. I do believe the health department needs to be a robust data hub for the community, especially for even nonprofit organizations, community organizers. We need to be able to provide data information to the community. So Danita, that's something we're working on. I do believe People's Community Clinic does have the data. I haven't seen it, and I think it's just a matter of time. But I do know they predominantly also serve the immigrant and refugee communities.
Okay, thank you.
Mhm.
Other questions? Let's see. It was asked, why is it important for a policy review before crises hit?
That's very important, especially for health equity, um, or for any type of equity. I think that it's very fundamental to have policy reviews, because there shouldn't be an assumption made that the policies of 10 to 5 years ago are still relevant for today. And so the health department, we've been very intentional in reviewing our health policies, and even our operational policies, because one of the things that's very key when you're intentional about organizational transformation as it relates to equity, that needs to be a common language even within your policies. Like, people need to when they read the policies, they have to be able to walk away and say, okay, this policy really was intentional in ensuring that it was inclusive of all people. And so that's one of the things that we've been doing, is every time we review a policy or we create a new policy, we utilize a health equity lens to do that. Asking ourselves, okay, what this statement, for example, if it's written this way, what does that mean? How can it impact someone? And is there a way to reword it to ensure that we're being inclusive? And it takes quite a bit of reviews, but it's very important to do that, because you transform organizations through also policy. So even if you take on this equity approach, you communicate it, but it's not within your policies, that's still problematic, because we know that the issues are systemic, and we know that the root causes of these issues are because of policies that have promoted inequities. And so it's very important to really take the time and review the policies. When you look at even recruitment strategies, right? The health department, one of the things that we've been very intentional is that we have to represent the population we serve. And so it's been one of the things that, in terms of recruitment, We're very intentional about recruiting people of color, and those that are also well connected to their community. We're building our community health worker model because we know that when you look at public health programs, community health workers are very successful in doing outreach and doing education of public health or health promotion. And so those are some very important things that we have to tackle. You also see that the data shows how when you have, immigrant and populations integrate into the community, their lifestyle changes. No one says like, hey, this amount of soda is a lot, because there's so much access to junk food, while in their native countries, perhaps junk food was more expensive, right? And so also you see that within the African American community where generations of healthy eating have been passed down, but because of how the conditions in which people live continue to be under resourced, there's more access to junk foods. There's not as much access to healthy food options. You see a lot of convenient stores that have a lot of junk food, alcohol. So those are all the things that as a health department, it's not only about individual behavior, but it's population health and also the environmental scan. So you can't ask individuals to change their healthy behaviors or lifestyle, but their environments promote those unhealthy behaviors and lifestyles. So, and that's all through policy change. It's really advocating for our environments to also change.
Okay. Dr. Somerville asks, healthcare and public health have been highly politicized in the United States. How can you stay on mission with public health priorities given all the competing messages? Great question.
Very great. And so I think that you're very right. It's been politicized, but I want to also state that public health has always been political, right? So discussions about public health have always been political. And I think that, one of the difficulties for us in public health is that public health is a field that is based on science and objective rationale. So that is our training, and it is very, very difficult for public health practitioners to see when it's politicized at that level, because here we are, like, this is the data, this is the right thing to do, this is just it's logic, right? But I think that what public health needs to do also is that we have to be prepared. We have to continue to advocate for public health. And that is also recognizing that anytime a public health policy has been changed, whether it's public safety, whether it's smoking cessation programs, whether it's policies of reducing sodas in vending machines, and all. It was a bipartisan approach, right? It was a bipartisan. So when I say public health has been political, there's always been a political side of public health. But we public health practitioners need to not shy away from our advocacy. We need to really engage with our elected officials as and also recognize that elected officials, and this is me, I do believe that have, they're in their terms for maybe 3 years, and then there's election. So there's all these competing priorities, right? And so, and with science, sometimes it takes a long time, right? Where elected officials might say, "What's the return on investment? What's going to happen? Tell me what's going to happen right now." And we're like, "Well, the data is not showing that yet. Maybe you'll know in 10 years, right?" That doesn't work with some elected officials, So we need to continue to engage, and we need to continue to not really shy away from advocacy. I think that it's just so important now, especially for us to learn also what advocating and promoting public health requires. And we also need community members. This is something whereby, for me, it's very important for the community to understand public health. Public health is the reason why you can drink your water from the tap, right? Public health is the reason why you can go to a restaurant and feel safe. But we've been such an invisible field, and for that, I don't hold that anymore as a badge of honor. I'm very passionate when I talk about public health, because I know that behind the scenes we're doing what's right for the community, but because the community doesn't see that immediately, I think also the opportunity for us to have community members advocate for public health hasn't been there, and I hope that and I do believe that the health department is going to go towards that direction in doing more and more community engagement, so that community members also understand what the important role of local health departments and funding, sustainable funding for local health departments. And I will be the one to tell you, this is what your property taxes do as it relates to public health. This is your return. This investment that you're making in public health, this is how it's benefiting the overall community. I don't mind sharing that at all, because I think it's important for people to know how what their property taxes do for them. Mhm.
Okay, well, thank you very much, Dr. Abonye. This has been a fascinating discussion, and I'm sure we could go for another 4 or 5 hours if we were allowed to.
Yeah.
Um, we are close to the end of our time. It's 10:48, and next session is 11 o'clock. Um, I'll close with one final question from Drew Conrad. It says, are there any lasting impacts from COVID that could create even greater inequities in our community?
Yes, I think there are, and that's the unfortunate reality. I think the first, the divisiveness of COVID, the approach. I think that we have to be intentional about uniting our community. We're already a segregated community. We already talk about how divisiveness doesn't help us. And so I highly encourage you all to whether it's just on a daily basis, but figure out how can we unite together. COVID doesn't look at, when COVID comes in the room, it goes after anybody it can get. It goes after anybody it can get. So we have to do this together. Mental health, I think that's one of the things that has been a recurring theme. I think it's going to really expand the inequities already existing in mental health. We hear a lot about how isolation, people that have lost businesses, haven't been able to reopen their businesses. I mean, it takes a toll on people. People that have lost people from COVID. You'll always remember this. This is not something that one can easily forget. And so I think that really our mental health um, services, and not only just access, but understanding what can we do for us to heal as a community moving forward is going to be something very important. Mhm.
All right. Well, again, thank you so much, Dr. Nafisa Ibonye, for your time today and for enlightening us on public health issues in our community. Certainly, with COVID-19 and the aftermath, years to come, we'll be still dealing with ramifications. So we're thankful for your leadership in dealing with this crisis, and look forward to seeing the positives in the years ahead of uh, public health department's involvement in our community. So we look forward to seeing everybody again at 11 o'clock for our next sessions. And until then, um, keep on thinking.
Thank you.